When you hear the words MRI and X-ray, you might picture giant machines and wonder which one you'd need and why. So, let's break down what these imaging tools really do, how they're different when doctors use each one. First up, X-ray. X-rays use a small dose of radiation to create images of the inside of your body, mostly focusing on your bones. They've been around for more than a century, and are often the first step when there's a suspected fracture dislocation or pneumonia. Why? Because X-rays are fast, widely available, and excellent for spotting breaks, bone infections, and certain lung problems. For example, if you fall and twist your ankle, an X-ray can quickly reveal if there's a fracture. According to research, X-rays remain the gold standard for diagnosing acute bone injuries. But X-rays have limits. They're not great at showing soft tissue like muscles, ligaments, or the brain. That's where MRI comes in. MRI stands for magnetic resonance imaging. Instead of radiation, it uses powerful magnets and radio waves to create incredibly detailed images of your body, especially soft tissues. MRI can spot torn ligaments, brain tumors, spinal cord problems, and even subtle joint injuries that X-rays can't detect. So, who needs an X-ray? If you have a sudden bone injury like a suspected broken arm or a chest infection, an X-ray is often the first choice. It's quick, accessible, and safe if used correctly. But if you're dealing with unexplained joint pain, a possible herniated disc, or you need to see inside your brain, doctors may send you for an MRI. Let's talk about when. In the acute phase, right after an injury, X-rays are usually the go-to for bones. MRI isn't always practical here because it takes longer and isn't as available. But it's invaluable for diagnosing soft tissue injuries in both the acute and subacute phases. For example, a torn ACL in your knee might not show up on an X-ray at all, but will be crystal clear on MRI even days or weeks after the injury. According to a study in the New England Journal of Medicine, MRI is more sensitive than X-ray for detecting ligament and soft tissue injuries, especially in the subacute phase. In summary, X-rays are perfect for a speedy look at bones and some chest issues. MRIs dive deeper, revealing the complexities of soft tissues, nerves, and the brain with stunning clarity. Both tools are essential, but the right choice depends on your injury, your symptoms, and what your doctor needs to know. Remember, always rely on medical professionals to decide which scan is right for your situation. Thanks for watching. If you found this helpful, hit that like button and stay curious.